are you satisfied with the technologies now you have been using for diagnosing the patient or, who have coronary stenosis or maybe developing some new coronary symptoms?
Yes, we've been using the technology here for the last 2.5 years. I've become, at least by being able to look at the clinical trial data that has been collected up until now, I'm convinced of the device's accuracy and the ability to detect obstruction greater than 70% in at least one of the coronary arteries. So we've had a tremendous success using the device in clinical practice, particularly to analyze patients who present with symptoms that are suggestive of coronary disease. That population of patients, at least in the United States, is a population that gets tested very, very frequently, very often, many times with negative results because they really do not have a coronary problem. This one device can tell you in one test whether or not a patient has a high likelihood of having a blockage or not. And so people who do not have a blockage can be reassured, and at least other forms of testing aren't necessary. They can be the treatment can be more directed towards their high blood pressure, their diabetes, their underlying risk factors, and less concern be placed on whether or not they have a blockage.
And do you have any experiences that with other tests the results were completely normal, but this test showed some higher scores than after the coronary angiography, you found some severe stenosis or not?
That's correct. Yeah, the device has, I think, an accuracy level that is superior to the traditional forms of testing, which invariably are stress echo and stress nuclear imaging. And so it is very, very possible to have an abnormal MCG score, have a normal nuclear test, and have blockage, particularly single vessel blockage, which notoriously is not able to be detected using standard nuclear techniques. So yes, the answer is yes. We have found evidence that the device is more accurate than some of the traditional stress echo and stress nuclear techniques.
I see. And it might be it doesn't do any extra harm like radiation or contrast substances. So that kind of burden were avoided using this system.
That's exactly right. Yeah, this technique has accuracy without the added risk of a contrast agent, intravenous delivery, catheter insertion, or a nuclear exposure. You're absolutely right.
So, do you think that it can be recommended to the lower risk people who may develop in some way in the future of the cardiovascular disease, but to screen whether there's something happening hidden in their bodies?
Yes, I think that this device and the accuracy that's created by the computational use of a big database of patients increases the likelihood that you'll be able to identify a blockage in an otherwise asymptomatic individual. The data, however, that we have currently, and we're basing all of our decisions and all of our teaching on, is not involving a population where there is no symptom.
I see.
So the purpose right now for the use of this device is in people that have symptoms but are considered at either a low or intermediate risk for the development of coronary artery disease. in that population where the prevalence potentially of disease is maybe 3 to 4 out of 10, this device performs much better than any other device in terms of the ability to separate the 3 or 4 people from the rest that actually have the disease.
I see. But usually we are using the regular electrocardiogram, and this is quite different from the currently used ECG.
Correct.
So why this system can pick up those newer informations?
Yeah, I think that's a very important point, and it's an important point for the doctor who is using this device to look into it enough to understand why this is different from the routine EKG or even from another type of EKG that's utilized called the signal averaged EKG. This device takes the EKG data and opens it up, meaning it exposes all of the underlying frequency-related information that's contained in the resting EKG. The traditional EKG ignores all that frequency information and looks for very specific changes in voltage over time, which can be influenced by a whole host of factors and oftentimes is very insensitive to small changes in electrophysiologic abnormality. So the new device, the MCG device, creates a greater sensitivity and actually a greater specificity because of its multitude of indexes that are used to make the diagnosis. And then those indexes from a particular patient are compared to a database that has indexes of disease that vary from no disease to very, very severe disease. So the computer is able to see instantly where a given patient fits in the continuum of index patterns from no disease to severe disease. So it's very easy to detect the presence of a problem based on this frequency-dependent analysis.